Let's dive into a classic UK-MLA OSCE station, the retained tampon. Now, this scenario is designed to test more than just your clinical knowledge. It's about your communication under pressure. Nailing this one? It's all about having a solid structure and walking in with confidence.
Welcome to this clinical walkthrough on the retained tampon case for UK-MLA, brought to you by Mediate, your 24/7 practice partner. Over the next few minutes, we're going to break down exactly how you can master this station.
So, what's the game plan? We'll walk through the 6 key stages of the consultation. This gives you a clear roadmap, right from your first hello to the final follow-up. Let's get right into it.
You know, those first 30 seconds can really set the tone for the entire consultation. Your goal here is to build rapport right away and create a comfortable space where the patient feels safe sharing what's going on. A strong start makes everything that follows so much easier.
All right, let's set the scene. You're the FY2 doctor. A woman in her 30s comes in and she's had a smelly vaginal discharge for about 2 weeks. Your job is to guide this consultation with calm, professional confidence.
An opening line like this, it's perfect. It does 3 things at once. It acknowledges her concern, it shows you're listening, and it respectfully asks for permission to proceed. It's polite, professional, and gets straight to the point.
Okay, let's move on to the history taking. A systematic approach here is absolutely non-negotiable. It's what stops you from missing crucial details and helps you build a really strong case for your final diagnosis.
Here's your roadmap for the history. Think of it as a checklist. We're going to hit all 5 of these key areas. Working through a structure like this shows the examiner that you're methodical, you're thorough, and you know what you're doing.
For the presenting complaint, you need to be a bit of a detective. You're asking about onset, duration, progression, and get specific about associated symptoms. Is there any pain, itching, fever? And don't be afraid to ask for a clear description of the discharge itself.
Next up, you have to navigate these more sensitive topics. The key is a matter-of-fact, non-judgmental tone. The question about tampon use is of course central to this case, but asking about sexual history is also important to keep STIs on your list of differentials.
This is where you show that you're practicing true patient-centered care. Using the ICE framework, ideas, concerns, expectations, proves you're connecting with the person, not just the symptom. Find out what she's thinking, what's worrying her, and what she actually hopes to get from this visit.
So, with that thorough history in your back pocket, you can now transition smoothly to the examination. Your communication here is so important for keeping the patient's trust and making sure she's comfortable. This is a fantastic way to propose the examination. It's clear, it explains why you're doing each part, and it respectfully gets that informed consent. You're telling the patient exactly what to expect, which is huge.
And here you can see the art of translating our clinical language into something patient-friendly. You've made a diagnosis, but how you explain it matters. You want to use simple, reassuring terms that inform her without causing any extra alarm.
All right, so you've found the tampon. What's next? You need a clear, structured management plan. The SIS framework is simple, it's easy to remember, and it covers all your essential bases.
SIS stands for Symptomatic Relief, Investigations, and Specialist Involvement. This simple framework makes sure you address the immediate problem. You look for any underlying issues, and you know exactly when to escalate. It's a powerful way to demonstrate logical thinking.
Let's break that down. Symptomatic relief, that's removing the tampon and offering pain relief. For investigations, a vaginal swab is essential to check for any secondary infection. And specialist involvement? That's your plan B, reserved for persistent symptoms or signs of TSS.
Now, knowing this plan is one thing, but putting it into practice under pressure is what builds real confidence. You can practice this exact case right now and get objective feedback on mymediate.com. It's a great way to drill these steps until they feel like second nature. Removing the tampon is just the first step. You're not done yet. Now you need to shift into education and safety netting. Your goal is to empower the patient so this doesn't happen again and to make sure she recognizes any warning signs. This is absolutely essential education. You have to go over these 4 points on tampon hygiene clearly. Advise changing every 4 to 6 hours with a hard maximum of 8. Recommend pads at night and always stress the importance of hand hygiene. Now, for a critical conversation, toxic shock syndrome. You need to explain that while it is rare, it's a medical emergency. Make sure she leaves your room knowing these red flag symptoms and understanding that if she experiences any of them, she needs to get help immediately. This phrasing provides a crystal clear safety net. There's no room for doubt about what to do if things get worse. This kind of direct, unambiguous instruction is vital for patient safety.
We're at the final stage now. Closing the consultation professionally shows that you're thinking about continuity of care, which, as you know, is a hallmark of a great doctor.
Before she leaves, lay out the next steps. Explain that you'll review her swab results, you'll contact her about any infection, and that you'll only prescribe antibiotics if they're actually necessary. This clarity provides a ton of reassurance and a solid plan.
So there you have it, a complete breakdown of the retained Tampon OSCE station. You've got the structure, you've got the key phrases, and you've got the clinical plan. Now the key is to make it your own. And the best way to do that is to practice. You can practice this exact case now on mymediate.com to build the confidence you need to excel. Good luck.